It's so important that we attract new and innovative leaders, primarily because we need fresh ideas and we need fresh approaches to how we address global public health. It's such a huge sector when you think about health, and it's exponentially growing and bringing in other types of partners. So it really is overwhelming. And as a leader, you've got to think fast about where you really want to focus your efforts and where you want to specialize. I think we're seeing that exponentially the challenges are becoming more complicated, more complex, but unfortunately there's less resources. How do you navigate this really complex and somewhat traditional structure that we have in global health when you think about the matrix of organizations that work and where they specialize, and to challenge that, to think differently about how can you challenge that structure to the better advantage of global health. Really spend as much time as you can in the field and less in the office. And as part of that, really hone your listening skills. The better and more effective you are at listening, the quicker you can be at learning, and the better partner you can ultimately be. So really listen, and absorb as much information as you can in the area that you've chosen to specialize. The second is really to be well informed, to be as well informed as you can about the area that you're working in, particularly as it pertains to some of the structures, the hierarchy in global public health and how you navigate that. And then the final piece of advice I would say is really never give up. I think it's so important, and this is what makes me excited about the next generation of leaders and optimistic about what the future holds, because if we can really encourage those leaders to never give up, to really think differently about how they approach health and healthcare delivery, I think ultimately tomorrow is going to be far more impactful than some of the progress that we're making today.